Hello. My name is Eva Ferguson. I've been chronically ill for the past several years of my childhood, but I'm one of the lucky ones. Within the first few months of my freshman year, I came down with a chronic illness that my doctors are still trying to understand today. It started out slowly, with fevers, frequent infections, and stomach issues that slowly turned into deep, aching muscles that left me bedbound for months. Between the months of September 2016 and January 2017, I didn't get to leave my bed often, but when I did, it was to see one of my many specialists at Boston Children's Hospital. My patient file bounced around from my pediatrician's office to rheumatology, infectious disease, immunology, and eventually landed in the hospital when I did, after I had an allergic reaction to a course of antibiotics. During my 10-day stay at Boston Children's Hospital, my doctors ran daily blood tests and gave me around-the-clock IV fluids to supplement what I couldn't eat or drink myself. Painstakingly, I was able to force food and water into my stomach, and 2 days before Christmas, I was discharged. I now had a team of GI doctors who were following my case. My symptoms and low weight stunned them, but what surprised me was the medical bills that would roll in over the next several months. I'm sure a lot of adults in this room know just how expensive healthcare can be, but as a teenager, I never really understood it until it affected me personally. The bill that arrived at my door was $50,000. $50,000 for the hospital room and the medications I received. But during my stay, I didn't receive any intensive care, only simple IV saline, which, in case you're wondering, is just a bag of salt water. Luckily for me, I have great health insurance that covered almost all the cost of my stay, but most Americans don't have that same luxury. We are living in one of the richest countries in the world, yet we have diabetics who are worried about keeping the lights on and a roof over their head, so they ration their insulin because it costs too much. And you know what happens to them? They die. So what do we do? In the United States, our economic system is a free market where government control over private companies is limited. This means that the price of handbags, calculators, bread, this rug I'm standing on, is controlled by the free market. So the higher the demand, the higher the cost. This makes it so that the price of medical products like a pint of blood or a bag of saline varies greatly across the country, because the price for these products is not set by the actual cost, but rather the demand. And since remaining healthy and alive is important to everyone, the price is able to remain ridiculously high. Drug companies and hospitals mark up the price of their procedures and medicines, so even when those prices are negotiated lower by insurance companies, they still make a generous profit. Some of those drug companies are Eli Lilly and Novo Nordisk, who produce insulin and market new drugs as new and improved while increasing the price. 20 years ago, Eli Lilly sold one bottle of insulin for $21. Today, they sell a bottle of insulin for $225. That's a 700% markup. But insulin companies aren't alone in making money off of sick people and marking up the price of drugs. Turing Pharmaceuticals acquired a life-saving medication called Daraprim, and overnight they increased the cost of one tablet from $13.50 to $700. That increased the cost of treatment for patients to hundreds of thousands of dollars. But drug companies aren't alone in making lots and lots of money off of very sick people. Hospitals also pull in lots of money through their emergency department through facility fees. Facility fees are what you're charged for just walking through the door of an emergency room, but you can't call anyone up and find out what this cost is because it's secretly negotiated between insurance companies and hospitals, and you'll only find out this number when a bill arrives at your door. The rest of your hospital care is comprised of costs for inflated drugs like insulin or IV saline. So how do we fix this? This system of overcharging makes health a privilege. a privilege that those with well-paying jobs with great health benefits get to enjoy. People like me and my parents. Meanwhile, the rest of Americans have to suffer through a broken system that turns their health into a commodity. How is this fair? In 2007, over 46 million Americans were uninsured, meaning those millions of people frequently neglected their health to avoid bankruptcy. And this fear of bankruptcy isn't unfounded. A shocking 62% of all bankruptcies in the United States are caused by the price of health care. So what do we do, and how do we fix this? As of right now, each insurance company negotiates independently with healthcare providers about how much a product like a hospital stay, doctor visit, or medicine will cost. Meanwhile, you, the patient, pay a premium every month to be covered. Insurance companies have thousands of customers, and most of them aren't unhealthy, so they just collect the monthly premium without providing much. But when you are sick, insurance companies help mitigate what would otherwise be devastating costs. Insurance companies are able to negotiate lower prices with affiliated facilities and hospitals because they promise lots of business to these facilities. So what if we had an insurance company that was bargaining on the behalf of millions of Americans at a time? Well, we already have Medicare, a proven system that effectively covers certain demographics. But Medicare leaves a large percentage of Americans uncovered. Most people get their insurance through their employer, but not everyone is employed, and not every employer has health benefits. Medicare for All, however, would make it so that any U.S. citizen could get any medically necessary treatment through a single-payer program where the government pays for the cost of treatment. Meanwhile, U.S. citizens would help pay for Medicare for All through taxes, in the same way that they already help pay for roads, schools, law enforcement, and anything else that the government provides. Medicare for All makes being healthy a fundamental human right, where no person can be discriminated against on the basis of economic status. Luckily for all of us, we have the power to make change. And I beg of you to help make that change, because I'm terrified. I'm terrified not only for myself, because when I turn 27 and get kicked off my parents' insurance, I can only hope that I'll be able to get the medical treatment I need. But I'm terrified for the millions of Americans right now who are uninsured. And I'm terrified that they'll get into a car crash or they'll get cancer, and they either won't be able to get the treatment they need, or they'll never recover from the bankruptcy it causes. So I'm terrified. What kind of country are we if we are this rich, this powerful, this great, and we let innocent Americans die of treatable conditions? That country terrifies me. So I'm using my voice and my constitutional right to make the United States a more democratic society. And my only question is, will you be there with me? Thank you.